Well, happy Tuesday and happy February, everybody. It's Dr. Christine Anderson here, or as my patients affectionately call me, Dr. Chris. And we are starting our series on heart health, kicking off with optimal heart health today. So if you are joining me today, let me know. Let me know who's out there. Say hi. And if you have any questions, just type them in and I will do what I can to answer them right now. And if not, I will answer them later in the comments. So, heart disease is the leading cause of death in the United States. It is a totally preventable lifestyle disease. So, this is something we totally have control over. 647,457 Americans have heart disease. Cancer comes in number two. Oh, sorry, that's people dying of heart disease. Cancer comes in at number two at just under 600,000. And this is how much it drops. Accidents are number three, as unintentional injuries at 169,936. So every day, more than 1,671 people die of heart disease in the US. That is almost 70 people per hour or more than one per minute. So by the time we finish today, hopefully I'm going to keep it as short as possible, but between 20 to 30 people are dropping dead of heart attacks. And so this is a real huge problem and why I want to spend some time on this with you. So if you stick with me till the end, I will have a special something for people who are sticking with me. So the reason I wanted to come on is there still is existing this outdated theory of heart disease. It's the diet heart hypothesis, where cholesterol and saturated fat are being made out to be the bad guys. So they're saying cholesterol is the cause of heart disease, and we need to get cholesterol lower. And guess what? I happen to have a little drug here called a statin, right? So at least 40 million people are currently taking statins. 40 million people. That's crazy. It is a cholesterol lowering medication, and it is making the pharmaceutical industry rich. It's generating almost $30 billion each year. So it is not just the issue of stopping the production of cholesterol, but it also has other things it does in the body to kind of screw it up. And the number one thing it does is it robs the heart of coenzyme Q10. And this is necessary for heart health and muscle function. And if it gets depleted, guess what? It can lead to heart failure, amongst other things. So if you are taking statins, you for sure should be taking the reduced form of ubiquinol, of Q10, which is called ubiquinol, especially if you're over 35 to 40 years old. So this is near and dear to me. My dad has heart disease. He had his first heart attack at 32. And it's actually one of the reasons why I'm a chiropractor. I started when someone introduced chiropractic to me. I was getting that connection between, as a doctor of chiropractic, being able to help people not only with problems and issues, but even prevention or being proactive. So my dad's still with us. His doctor has him on statins, and finally I got him on ubiquinol after years and years. But what you're going to find out from me right now is that people who are so worried about cholesterol are missing actually the big picture here, and we're going to go into that. So millions of people are avoiding foods that contain saturated fat and cholesterol, and they're saying saturated fat raises cholesterol, which is partially an issue, but there's something even more that's at stake here. So they're saying that this cholesterol clogs the arteries, and that plugs the arteries that go to the heart, and then you have a heart attack and you cut off the blood supply. So the question is, as I looked at this, is this focus on cholesterol actually improving the incidence of heart disease? So, a 2018 study was published in the Journal of the American Heart Association, and they concluded that although coronary mortality has decreased, rates of cardiovascular disease remain high. In other words, more are surviving their heart attacks, but there's the same amount of people are still having heart attacks. Okay. Their further conclusion was intensified efforts to modify contributing risk factors are still required. And that's the key there because these risk factors are all lifestyle oriented. So let's just take a look a little bit at what actually is cholesterol, this evil substance that's creating all this heart disease, supposedly, right? So it's a soft, waxy substance and it's found in your bloodstream, sure. But guess what? It's also found in every single cell in your body. So your body actually makes cholesterol because it is necessary for cell wall structure and function. 80% is made in the liver and the intestines, and other sites that make it include adrenal glands and your reproductive organs. And the brain has to make its own cholesterol because it can't get through that blood-brain barrier. But it is also necessary for your nerve cells in your brain cells, to have cholesterol to actually exist. So we make it because we need it. And so if we're already making it, then it is something, right, that we need in the body. So let's see what it does. It helps to make those cell membranes. It is making up hormones, vitamin D, bile acids that helps you digest your fat, and it helps in the brain to form your memories, and it's necessary for brain function. So just a little bit, delving a bit more into cholesterol. I'm not going to go super in detail on this, but I still think it's important because you will see these lab tests being done. So you have your different types of cholesterol, which are the high density lipoproteins and the low density lipoproteins, or HDL and LDL. Now you're going to hear people say HDL is the good fat and LDL is the bad fat. It's a little bit more complicated than that. But basically what the HDL does is it takes the cholesterol from your body's tissues and arteries, and it actually brings back the cholesterol into your liver so it can be recycled. So we're not trying to get rid of it, by the way. We're trying to recycle so we can use it again. Now, the low density lipoproteins are, according to conventional thinking, can build up in your arteries, form a plaque, make your arteries narrow, less flexible. And then especially those smaller, denser LDL particles, they can create problems as they try to squeeze through the lining of your arteries, and they can actually trigger inflammation. And keep that in mind because that is the key. So if a clot forms in one of these narrowed arteries leading to your heart, or if it's your heart for a heart attack, or to your brain for a stroke. So that is kind of the thinking in this realm. Now, also making up your total cholesterol count would be your triglycerides and something called lipoprotein A. And triglycerides, if they're high, have been linked to heart disease and also diabetes. And this is actually the key. They raise not from eating too much fat, but they are raised by eating too much grains and sugars. That is going to be a key that we're going to talk about in a moment. They can also raise if you are physically inactive, or if you're smoking cigarettes or drinking excessive alcohol, and being overweight or obese will usually coincide with an increase in triglycerides. Now, lipoprotein A is a substance that's made of that LDL, bad cholesterol, plus a protein. And this one actually is a test that is a strong risk factor for heart disease. And even though this is well established, not many physicians actually check for it. So if you suspect you have heart disease, you do want to check for lipoprotein A. Okay? Now, here's where we start to butt heads. So, the American Heart Association recommends that your total cholesterol is less than 200 milligrams per deciliter. They actually like to see it around 150. But little do they don't tell you this, but the total cholesterol is worthless in determining your risk for heart disease unless it's above 330. So it's not really a good way to test to see if you have high risk factors for heart disease. But if you're looking at cholesterol as being optimum for your health, for your cells, for your body, it should be optimally around 200. So studies have showed an inverse link between mortality from all causes and total cholesterol levels. In other words, your death rate is higher when your cholesterol is lower, and that's without exception. So, to me, cholesterol is not the issue here. So, if you are getting these blood tests done, rather than just looking at your HDL levels and your LDL levels and your triglycerides, looking at the ratios will give you way more information. So your HDL to cholesterol ratio should be ideally above 24%, and your triglyceride to HDL ratio should be, that percentage should be below 2. All right. So that gives you a guideline for those normal tests that they do if they're looking for cholesterol and HDLs. Now, cholesterol gets a bad rap for doing its job, basically. So when there's damage to arteries, cholesterol is released because its job is to repair the damage, and it will form a scar or a plaque, as they call it, in the artery. When there's that damage is there because there is inflammation. And that is going to be the key, because if you have diabetes or chronic inflammation, that's going to eventually deteriorate your capillaries, and that's going to reduce your collateral circulation around your heart. It's blood vessels that bypass those main arteries, and that's when you're going to be more prone to having a heart attack. So it's not the cholesterol, it's what's going on with inflammation. Now, here's another thing that is not usually checked, something called C-reactive protein. It is a blood test that determines if you have chronic inflammation, and this is not typically being done. So generally speaking, a CRP, this is what it's called, level under 1 milligram per liter of blood means you have a low risk for cardiovascular disease, another name for heart disease. If it's 1 to 3 milligrams, it means that your risk is intermediate. And if you have more than 3 milligrams, then your risk is high for heart disease. So let's start to see what causes inflammation so we can start to look at some of these really the true causes of heart disease. And chronic inflammation is actually caused by a laundry list of items that produce free radicals. So free radicals, it's not some like special group that goes around, they create damage. So they are a special group, but they're a special group of electrons in your body, and they're unpaired. So they're sort of radical or rogue, if you want to say that, and they ping around and create damage in your arteries and anywhere that they're present. So it could be your brain, it could be an organ. But right now, we're going to just talk about what happens inside of the arteries. So the things that create these free radicals would be eating lots of sugars and grains. So this is why you want to test your fasting insulin level, because sugar and carbohydrates will increase that inflammation. They'll release insulin, and they're going to promote the accumulation of fat and creation of triglycerides that, number one, are going to wreak havoc in your arteries, and it's going to make it very difficult to lose weight and create excess fat around your midsection, which is another one of the major contributors to heart disease. So if your waist is measuring larger than your hips, that's a risk factor. All right, so your ideal fasting blood insulin level, and insulin is the hormone that helps drive sugars, glucose into our cells. Okay, so an ideal fasting blood insulin level is below 3 microunits per milliliter. And the way you get that down is by reducing carbohydrates. So that's processed sugars, processed grains, flours, definitely all the cookies, cakes, that type of thing. But it may even mean that you're cutting out things like wheat and rice and grains and that type of thing. It really depends what your level is. Maybe even high glycemic fruits. Your fasting blood sugar level should also be checked because studies have demonstrated that people with higher fasting blood sugar levels have a higher risk of having coronary heart disease. So, when your fasting blood sugar is between 100 and 125 milligrams per deciliter, your risk of coronary artery disease increases 300% more than those level is below 79 milligrams per deciliter. So that's huge, 300%. Now, other contributing factors to all of this might be things like leaky gut. And in the future, we're going to be talking more about the gut and its relationship to health. You want to check your iron and your ferritin levels, which is your storage form of iron, because this creates oxidative stress. And that's what's created when free radicals go crazy in your body. So, an ideal iron level for an adult male or a woman past menopause is between 400 and 600, 40 and 60 nanograms per milliliter, and a ferritin level below 80. And we'll talk in a second about what to do if to maximize these things as we go into the tips. You want to check your magnesium levels. Now, blood magnesium levels aren't always the best way. Checking red blood cell magnesium level is better, but most people are not getting enough magnesium because we're just not getting enough magnesium into our food now. The levels are so much lower in our ground, in our soil, so it's not getting into our food. Magnesium inhibits the deposit of fats onto your arteries and therefore helps prevent that plaque formation. And there's actually an inverse relationship between the levels of magnesium in the body and the level of C-reactive protein. So the more magnesium you have, the less C-reactive protein, meaning less inflammation. All right. So the other things that will contribute to this free radical formation is going to be things like over-exercising, deep frying oils, and reusing your oils, using trans fats, which is again created when you're deep frying, cooked and processed meats, X-rays and other radiation, ozone rays, cigarette smoke, air pollutants, industrial chemicals, household chemicals, and other environmental factors. So let's talk a little bit about how to optimize your heart health. And I have to say, number one, go back and watch the first episodes of Optimizing Optimal Health, Optimal Life, because I talk about the 7 facets of health in the first session. I talk about optimal diet and nutrition in the second, and I talk about optimal movement in the third. So I highly, highly recommend go back and watch those because a lot of what I'm going to say is pertinent to what I've already said before. Number one, get regular chiropractic care. The brain controls every single function in the body, including heart function. So you can eat all the good things you want and exercise, but if your brain cannot tell your heart what to do, then that's going to be a strike against you. So chiropractic adjustments remove any interference to this communication of the brain through the rest of the body, through the spinal nerves, so that you can optimize your overall health and well-being and functioning. The other thing chiropractic adjustments do is balance the autonomic nervous system. So this is the part of our nervous system that we don't have to think about. It's automatic, right? You don't sit there and think about your heart beating and your lungs breathing. You may do some deep breathing. You may be able to slow your heart rate, but this stuff happens whether you're thinking about it or not. So the sympathetic part of this system is like our gas pedal. And it's the part that activates when you need to fight or flee or freeze. And it's supposed to be for a short period of time and then you recover. But what happens is if you have chronic stress and you're constantly in a sympathetic state, it means that your body is always on. And a lot of things happen with that. But what it can do is it can increase your blood pressure, it can increase your heart rate. And another thing it can affect is something called the heart rate variability, which I'll talk about in a second. The other side of this is the parasympathetic system, and that's more like the brakes. And this becomes activated when we're relaxing and we're digesting and we're repairing. So we have these two aspects to our autonomic system that can be affected by chiropractic. And one of the tools I do use in my chiropractic office to determine heart health is the HRV, or heart rate variability. So this is something that can help identify whether or not there are imbalances in the autonomic nervous system. And according to the research, chiropractic has a positive effect on the heart rate variability. So they've done some research on this. It also, there's been a correlation between chiropractic and lowering blood pressure. And I've done that where I've taken blood pressure before and after and definitely seen the effects on that. Number 2 is to reduce or eliminate carbohydrates. This is the key, not saturated fat or cholesterol. So especially, as I said, the refined and processed stuff, cut the sugar out, reduce your high sugar fruits if you really want to drop your risk of heart disease. And if you have high cholesterol, you may need to get those fruits out altogether for a little while. So most grains, especially flour, especially if you also have high insulin levels. You're going to consume essential fats. Those are the omega-3s mostly. That's going to be things like nuts and seeds, seaweed, marine algae. If you're eating animal products, then krill is a good source because it's a very small creature, not going to concentrate those toxins as much as the larger fish. So a recent research study suggested that high doses of 4 grams of omega-3 fats, EPA and DHA, may help improve healing after a heart attack. So that's after. Beforehand, we still want to take these essential fats. And then the quenching of those damaging free radicals. You want to use things like vitamins A, C, and E, selenium. There's carotenoids in colorful fruits and vegetables, so you want to get those in. Resveratrol, astaxanthin. And then you want to support your endogenous sources of antioxidants. These are the ones that we make ourselves. That would be glutathione. You can take things that help your glutathione recycle, or there are ways to actually take glutathione, but it's got to be specially formulated because it doesn't like to be absorbed well. I spoke about CoQ10. It's another thing to help support your heart as well as all muscular function and your mitochondria. But if you're older, you want to actually take the reduced form of ubiquinol. And then there's alpha lipoic acid. So you've got your colorful fruits and vegetables. You've got your sprouts, like pea and sunflower sprouts contain a lot of antioxidants. And I like to consume the wolfberry or goji berry from the Ningxia region of China. So I get that in multiple ways, from a puree to actually having the wolfberries, because that has a high ORAC value of 30,000. And this is a value of measurement for how active that antioxidant activity is. And just to put it in context, blueberries are like 5,000. There are actually some herbs and spices, including some essential oils that have high antioxidant contents. Believe it or not, cloves have 1 million ORAC value. So super high antioxidants. Cinnamon also, oregano, turmeric, ginger, garlic. Organic green tea, just make sure it is a good quality because there's a lot of processed green tea variants that don't really contain the active component of something called EGCG. So you just want to make sure that you're getting good quality there. You want to get enough vitamin D. Vitamin D, remember, we need cholesterol to make vitamin D. It's a steroid hormone. And new research suggests that vitamin D3 plays a vital role in protecting the cell walls that line your arteries. It's called the endothelium. Remember, that's the part that if it gets damaged, it gets inflamed, then you have the plaque, then there's the problem, okay? The other thing is the presence of vitamin D3 also triggers something called nitric oxide, and this is a molecule known to help control blood flow and prevent blood clot formation. So another thing you can do that I'll talk about is an exercise to help with this nitric oxide flow. So the other aspect to this is that if you are taking vitamin D, you want to also do magnesium with it, and you want to do vitamin K. So there's different forms of vitamin K. I like a vitamin K2-7 supplement that I take because the clinical trials have demonstrated that this particular vitamin K has the ability to not only increase cardiovascular health, but strength, endurance, and bone health. The problem being that if you take vitamin D without vitamin K, you can get calcium actually depositing in the arteries and in your tendons instead of into your bone. So we want to make sure that we're not doing that. And this particular supplement that I take has a study where it shows 8 weeks of supplementation as being equivalent to 6 months of high intensity interval training, which has its own benefits. And I promise I'm getting to that. Optimize your iron level. If it's too high, donate blood. Do some heavy metal detoxification, perhaps. Test for leaky gut and repair that if it's damaged. Like I said, this is going to be something I do cover in depth and detail. And make sure you're working on that diet aspect. Go back and listen about the diet. Optimize your magnesium levels by taking a supplement if you need to. Just watch out for magnesium citrate because it can cause loose stool. And you definitely want to try and get about 500 milligrams of magnesium in. And magnesium threonate appears to more efficiently penetrate all the cell membranes. All right, a little bit about optimal exercise. When you exercise, you increase your circulation and the blood flow throughout your body. So that's going to help get oxygen to your body. And this is and to your heart too, right? So to increase that nitric oxide into your blood vessels, there is a special type of high intensity interval training called the nitric oxide dump. And I talked about this in the exercise presentation. So go back and look at that. And when you subscribe, you're going to be able to get an alert when I post the video on this exercise. So I will be doing that soon, and you can take a look at it because all it entails is 3 to 4 minutes of exercise 3 times a day that pretty much anybody can do. So nitric oxide is going to help be a messenger to the rest of your body to help boost cardiovascular health, expand your blood vessels, and dilate them so it will lower blood pressure. And it's going to decrease the viscosity of your blood, which will lower your risk of blood clotting which can contribute to heart attacks and strokes. So HIIT in general is a great way to help your heart cardiovascular system. You're not producing too many free radicals like over exercising can, so it's a great way to do that. Obviously, do things like quit smoking, limit your alcohol, replace your toxic household cleaners with non-toxic options. Go to www.ewg.org. Check out what you're using in the household, because if you are using chemicals, that can be poisoning your system, affecting your cardiovascular system and every other system in your body. All right. I know everybody's going, well, what about stress? What about emotions? Guess what? This is a 4-part series on heart health. Next week, we are going to have a special guest, Carol Allen. She is an amazing person. She's the author of Love is in the Stars. She does relationship workshops. And we're going to be talking about relationships, which is important for matters of the heart, right? The following week, so in 2 weeks, I'm going to be talking about stress specifically. So stay tuned for that. That's on the 18th of February. Certainly in the meantime, do things that are going to help you with lowering your stress level, things like yoga, meditation, hobbies, deep breathing, getting outside in nature, walking with bare feet under the trees. All that good stuff is going to help ground you and have immense benefits. And then with emotions, we're going to be touching on this in 3 weeks on the 25th of February when I talk about living your life optimally. So if there's anybody out there, say hi. If not, I'm going to sign off, and please like this, share this if you think I have some good things to offer with your friends and family, and please subscribe so you get those notifications when I have new posts. All right, everybody, have a great evening, and I will see you next week. Bye.